Gentrification is a word I hear a lot of at home. I'm a native New Yorker. I grew up in the West Village, an area which has been gentrifying since my childhood. It's almost a dirty word at home, because you know a neighborhood is going to be irreparably changed once it begins. The word was coined in 1964 by a British sociologist, and its definition hasn't changed in the subsequent years. It essentially describes the process of a lower-income community transitioning into a higher one at a faster than median rate. There's also some type of word associated with violence that goes on when gentrification is called into play. I chose to examine the intersection of healthcare access and gentrification, specifically in the West Village, since the closure of my major community hospital. St. Vincent's Catholic Medical Center had been an 160-year-old facility. It was a full-service hospital, the main ER after 9/11, and the HIV/AIDS hospital during the AIDS epidemic. This meant that there was a strong emotional tie to this location, not only for the local community, but for the city as a whole. The hospital closed its doors in 2010, only to reopen a couple years later with a few modifications. It was converted into a luxury condominium, and when I say luxury, I mean that the cheapest unit was $14.5 million. The next most expensive being $21 or over $1 million. Needless to say, this increased total area cost significantly. And it also eliminated local full-service care. I was curious what this meant for the local community. Did this gentrification completely limit access to care? I conducted a mixed method study. I utilized content analysis, survey, and interview, and through my data was able to see that it did in fact negatively affect the community. Those I interviewed stated that they had little to no access to their previous care, and that decade-long doctor-patient relationships had been severed. Specialized care is no longer available, and since gentrifiers are generally young, wealthy, and healthy, they don't mind seeing private care facilities, full-service hospitals, and other clinics closed in favor of artisan coffee shops or vegan cafes. My participants stated they were saddened and angry about the closure, and that they still struggle to find adequate local care. In the end of the day, continuity of care and total area health are being jeopardized by this gentrification. While I was looking at a specific area in downtown Manhattan, there have been 13 hospital closures across the 5 boroughs in the past 10 years. The rate of closure raised red flags for me in terms of overall community health in the greater New York City area, especially in the coming years. Thank you.